Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Dementia Diagnosis Now What? Presented by Nina Davis. Sponsored by Prince George's County Government and the Department of Family Services.
Welcome everyone to tonight's presentation. As they mentioned, my name is Nina and I am the support and outreach coordinator at Insight. And tonight we'll be talking about dementia diagnosis and what to do afterwards. So a little bit about Insight. Our mission is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, as well as for their partners and for the rest of the community. And our vision is to have a community where those living with memory or cognitive impairment are able to achieve the highest quality of life, not only for themselves, but also for their care partners. So we're the leader in dementia care in Northern Virginia. Insight started as a nonprofit in 1984, supporting families who had Alzheimer's, and we have evolved over the past 41 years, and we do this through care, connection, and creativity. So with care, we have our specialized adult day programs for people in all stages of their dementia journey. We have connection by building relationships and supporting care partners throughout their journey. And last but not least, we have creativity by having dementia experts share their knowledge and resources, since every journey is unique. So starting off, we're just going to talk about a little bit about normal aging versus dementia. So as you can see in this table, on the left-hand side, normal aging, some symptoms that, or not symptoms, but some occurrences that are typical as you get older would include not being able to remember details of a conversation or event that took place a year ago, not being able to remember the name of an acquaintance, forgetting things and events from time to time, occasionally having difficulty finding words, and also being worried about your memory, but your memory issues not being noticeable enough for other people to have concern. So that would be things with normal aging. Now, with dementia, there are some symptoms that you would typically notice, and I would like to preface by saying that usually you need one or more of these symptoms occurring together in order to get further evaluation for dementia testing. And these would include not being able to recall details of recent events or conversations, not recognizing the name of a friend or family member, forgetting things or events more frequently, frequent pauses and substitutions when finding words, and having people around you be concerned about your memory. So in addition to you having concerns, also it will be super noticeable for your loved ones around you. So next, we have mild cognitive impairment. So this is typically a stage prior to a dementia diagnosis. It is not a type of dementia, but it is a stage where it causes more memory problems that are typical compared to others in your same age group, but it's not enough to interfere with your day-to-day living. But it typically is a precursor to a dementia diagnosis, and it can increase your chances of acquiring dementia, but not everyone who has MCI will go on to develop dementia, but it does increase chances. So what is dementia? Dementia is not a normal part of aging, and dementia describes a group of symptoms affecting thinking, language, and social abilities, severe enough to impact one's daily routine and day-to-day living. And dementia isn't a specific disease. So as you can see in this umbrella, dementia is just the overall umbrella term describing symptoms that affect memory and judgment and all those different things. So on the left-hand side, these are irreversible. So that would include your Alzheimer's dementia, vascular dementia, dementia with Lewy bodies, Parkinson's disease dementia, frontotemporal degeneration, and so forth. There are over 100 types of dementias that one can acquire in this lifetime. And then on your reversible side, infection, depression, tumor, metabolic disorders, medications, vitamin deficiencies, alcohol. So all of these things can be reversible, but the reason why we state that is because sometimes these certain things can mimic certain symptoms that could be similar to dementia. So it's really important that you try to rule out any other causes before automatically assuming that it could be dementia or related. So just keep in mind that these things can be reversed. So after you do get a dementia diagnosis, it's super important that you get everything planned out ahead of time. So these can include personal, legal, financial, and healthcare. So for personal, whether that be family-related matters, so deciding who's going to be taking care of you, or what things you have to get settled before tackling on this dementia journey. So whether it's for yourself or for a loved one, figuring out those different pieces. And then for legal purposes, this is super important as it usually is a struggle, especially with a dementia diagnosis. So some things you may want to get a hold of would be having a power of attorney for finances. So this would be directing someone who can make financial decisions, especially if a person gets to the point where they're not able to make those financial decisions for themselves. Maybe creating a will. So if you have family members deciding how a person's estate will be divided amongst different people, maybe having a living trust, maybe contacting an elder law attorney that can help you get those different things. So like maybe a financial power of attorney or medical power of attorney, any of those different things. An elder law attorney who specializes in those, especially with dementia cases, can assist you with that. And there are resources that we can go over at the end of this presentation. Next, we have financial, so that ties in to all the legal matters. So like I mentioned, will deciding how you're going to pay for care. So whether that is through Medicare or Medicaid or a long-term care insurance, or maybe if you have VA benefits, any of those things that can help you pay for dementia care is something to keep in mind of. And then healthcare, those all tie in together. So whether you're thinking of aging at home, so maybe getting home health care instead of going to an assisted living or an independent living, or maybe going to a continuing care facility, so a place that has all three, independent, assisted, and memory care. I know typically people think of nursing homes, but those would be options for people who have Medicaid, but memory cares are a great way to care for somebody with dementia. Or if you don't want to move into a facility, then having places like adult day centers that can provide that stimulation and socialization that one may need, especially as their dementia progresses. So those are just some couple of things to keep in mind, and please feel free to ask questions in the chat box, and then we'll explain it afterwards. So planning for the future. This would include about educating yourself about the disease. So, for example, seminars such as this would serve as like a portion of educating yourself, but it's really important to do your own research online, like with the National Institute of Health or Central Disease Prevention Center, or like the Alzheimer's Association. And then, like I mentioned, how dementia is split up into different types. You can go for specific websites related to a specific type of dementia. So they have Alzheimer's.org, frontotemporal degeneration.org, Lewy Bodies Association, all of those different types of dementias usually will have their own webpage where you can do more research about the disease. You also may want to review finances with a professional. So getting in touch with an accountant, or as I mentioned, an attorney who can help you set up a will or a trust if you have things to be divided amongst family members. Next, you would want to review and update legal documents with a professional. So yes, that could also be tied in with having an attorney, an elder law attorney, and then also asking yourself, what are your abilities and limitations as a caregiver? So caregiving is a very strenuous and emotionally and physically exhausting job. So you ask yourself, what am I able to do for my loved one if the person you're caring for is not you? So whether it's having all your ducks in a row and deciding whether you want to take care of your loved one at home, or you want to put them in a place where they would be where they're all their parts of their selves or would be cared for. So as I mentioned, a care facility like an independent living or assisted living or memory care unit, those would be great things, great places for somebody who is on the verge of deteriorating with their dementia. So these are just some questions to ask if you are a caregiver or you have loved one. And next, you want to start the conversation. So inform family, close friends, neighbors, and other providers of the diagnosis. If you are comfortable, I know dementia can be a touchy subject, so it's important that you do inform those who, care, or, if you don't want to inform everyone just yet, then uh, informing those who would be on board with providing who would be caring for your loved one with dementia. Also involving the person living with dementia in all aspects of planning while they still have capacity. So while they're still able to make decisions for themselves, like I mentioned, you would want to get maybe an elder law attorney, maybe a care manager who can help with planning for health care, and also giving them the choice to decide what they want to do when they get to the point where they're not able to make their own decisions. So having them delegate to whoever it is that can help take care of those things later on. And also learning the importance of effective communication. This is super important. I know a lot of families, they would, be in favor of having counseling, or, being on board with the care managers or any sort of social worker that can help communicate any struggles with planning care for the person affected by dementia. Next, you want to develop a care team. So these can include family and friends who are willing to help or pitch in, healthcare providers. So these include your doctors, your neurologist, maybe physical therapists, or any of those healthcare providers that you would need depending on your situation. But neurologists and primary care physician are typical for people with dementia. Organizations, community groups, faith-based organizations. So whether this be like your local church or temple or mosque, or maybe you have organizations like your community center, or maybe any sort of volunteer place. Those can be the types of people you may want to rely on during these difficult times with dementia, and also seeking out professionals that can help. So as I mentioned, care managers or caseworkers, or places like Insight, for example, who can help you plan out for your loved one or even yourself when dealing with dementia. Next, you want to make a plan. So identifying sources of support and resources before they are needed, including caregiver resources. So Insight would be a great place, but any other any other organization or anything in your community that could be of support is definitely important to seek out during this time. Also discussing care values and the role that they play. So discussing what type of care you'd like and the type of role it will play when you're going through your dementia. Also sharing your preferences for care. So while you're still able to, this kind of ties in with, giving a person autonomy before they get to the point where they're not able to make their own decisions. So whether that means they want to stay at home or they would rather go into a memory, well, not a memory care, but a facility that could better serve their needs. And usually these facilities are really great since they have a lot of different things. They provide food, they provide socialization, they provide care, and anything that would help them thrive or have a high quality of life with dementia. So yes, it's important to understand that you take these into consideration when making a plan, and also communicating the plan to families. So it can be a bit difficult. I know there's a lot of family dynamics, and it can be hard to reach a common ground when developing a plan for a loved one who has been affected by dementia, or just like in general, developing a plan for a family member. So it's super important that you try to uh, find uh, try to stay on the same page when it comes to communicating and creating a plan with family members. So because ultimately it's the one affected by dementia who's going to be impacted by the choices of those around of the people around them. So it's super important to try to reach common ground and communicate with each other about what uh, things you want to happen for when it comes to the care of your loved one with dementia. So next we have our SHARE program. So SHARE is stands for Support, Health, Activities, and Resources in Education. We are trained to provide SHARE, but other places are also trained to provide SHARE. But the goal is to have SHARE partners and help them communicate effectively as they plan for the future. And one of the great things about SHARE is that it promotes health and well-being of SHARE partners. It can really help them reduce stress, and it could also encourage SHARE partners to take better care of themselves and each other by engaging in fulfilling activities. We also learn about community resources that support SHARE partners' values and preferences. And of course, we provide education about dementia and how to manage the changes that lie ahead. So SHARE is a great resource for times of like these. So uh, take utilize SHARE. Utilizing SHARE would be a great way to have that resource, but there are other sources out there that can help you create an effective plan when it comes to your loved one with dementia. Next, you want to find support. So there are a lot of different options that you can find online. So for example, getting involved with a support group, and they have so many different support groups for different types of dementias. So it's not just Alzheimer's, but they have, FTD support group, Lewy body support group, vascular dementia support groups. Any of those support groups can really help, take the stress and load off emotionally. And the wonderful thing about support groups that they're oftentimes free. And with COVID happening a couple years ago, they have now transitioned a lot of support groups online. So if you find yourself being unable to leave the house as a caretaker, then you can join online support groups to really communicate with other caregivers who are going through the same thing as you. You may also want to consider counseling. They have dementia counselors, or even if you just want counseling just for overall stress or pressures of daily life, then that's something that I highly encourage. Also, consulting a professional, such as a dementia consultant or a care manager. Those can help you find resources and locate the necessary care for your situation. And also hiring help. So this can come in forms of a companion, a care aide, or a home health aide, though, or like a CNA. Those things can usually be found with a home health agency. Or you can go on places like care.com, but those you have to do your own independent vetting because, those are typically like third-party websites and they wouldn't be through an actual agency, but those are options that people have used. So those are just there in case you need them. Also, caring for yourself. So while we had discussed all these different things for your loved one, it's really important to make sure to take time to or find a time to care for yourself when possible. I know it can be super hard, especially if you are a sole caretaker, but there are a lot of things that you can do to help manage your stress and help with overall self-care. And these can include getting involved with the support, but these two kind of tie in together. Oh, so caring for yourself, so that could be finding a support group, or maybe that could be taking care of your health, right? So exercising more, eating well, because when you're a caretaker, it can be really easy to let yourself go, whether that be physically, emotionally, spiritually, you name it. All those different things can be put on the back burner when someone else has become your main focus. So it's really important, and I know it's easier said than done, but little things that you can do to change to help keep you healthy in order for yourself, and also while you're a caretaker, it's super important to keep in mind. So ignoring the stuff on the screen, because that's a double a duplicate. Caring for yourself, so that would be support groups, taking care of your health, socializing with friends, right? Because lack of socialization has been shown to increase chances of cognitive decline later on. So it's super important that you find your community, whether that be like through your family, your friends, maybe joining groups of interest. So maybe finding like a sports group, or maybe a book club, or maybe you volunteer, right, for a cause that is of importance to you, right? Those different things can help with socialization. Maybe taking yourself on a vacation and getting some respite care for your loved one, that could be an option. Anything that makes you happy in general is highly recommended to incorporate on a regular basis. And I know it can be hard to take care of yourself, but it's really important that you try to find the time when you can to implement that self-care routine. And here is an Inside MTC.org checklist. I would highly encourage that you check our website, since a lot of our stuff on there is free to the public. So we have a diagnosis checklist, we have a warning signs document, we have free webinars that discuss all types of topics that you could possibly think of when it comes to caregiving. So these include financial considerations, activities for loved ones with dementia, finding nutrition for dementia, all those different things that you can think of. We have it on our website, and we have it in webinar form. We also have articles and blogs. We also offer free consultations, especially if you need someone just to talk to about your day-to-day life as a caretaker. So these are just some of the options, and I would highly encourage check out Inside MTC, or any any resource that can help you navigate the dementia journey. And here are some resources. So the Elder Care Locator, National Institutes of Health, SHARE program, and Prepare to Care by the AARP. So if you guys can take a picture of this. Okay. And this is just our little a little model of what we do. So care, education, and support. So with our care, we have our early stage, we have our adult day health center. Education, we have free classes for caregivers, community workshops, we have professional training, and we have caregiving at a glance guide book. And then support, we have a support groups, consultations, memory screenings, memory cafes, and caregiver crews. And here is our information.